Greetings and welcome to Health Angel Solutions. In this video, we'll discuss the thyroid hormone, which is a crucial hormone in our bodies, and what happens to your body when it doesn't produce enough of it. Thyroid gland, a little organ in the front of the neck that surrounds the trachea or windpipe. It resembles a butterfly, with a smaller center and two huge wings that encircle the side of your throat. The release and regulation of thyroid hormone levels is a crucial function of the thyroid. Thyroid hormone is primarily responsible for regulating your body's numerous essential processes, including metabolism. Your body uses a process known as metabolism to turn the food you eat into energy. Your body uses this energy to maintain the proper operation of several systems throughout your body. The two hormones that the thyroid produces control the body's energy use. Your thyroid will maintain the proper hormone levels to keep your metabolism operating at the proper pace when it functions normally. Thyroid conditions are highly prevalent. Indeed, approximately 12% of individuals will encounter irregular thyroid function at some point in their lives, and 20 million Americans are thought to be afflicted with thyroid disorders of some kind. Compared to men, women are 8 times more likely to experience a thyroid condition. Furthermore, thyroid issues worsen with age and may impact adults and children in distinct ways. When this hormone is present in very high or low amounts, thyroid problems may arise. Based on this, the signs and symptoms of thyroid disease can be categorized into two groups: those associated with hyperthyroidism, or having too much thyroid hormone, and those associated with hypothyroidism, or having too little thyroid hormone. We'll quickly review the symptoms of hypothyroidism and how low thyroid hormone levels impact our bodies in this video. Remember that they are only symptoms and do not provide conclusive evidence of the illness. Therefore, always get professional advice from a doctor before making any snap decisions. So let's get started and examine the first of the 10 symptoms of hypothyroidism. I'm feeling worn out. Being fatigued is one of the most typical signs of hypothyroidism. The hormone called thyroid affects energy balance and determines when you feel rested or energized. Depending on what else is going on in your body, thyroid hormone receives signals from the brain and directs cells to adjust their roles. Individuals with elevated thyroid hormone experience anxiety and jitters. Conversely, those who have low thyroid function experience fatigue and lethargicness. People with low thyroid feel tired even if they might be getting more sleep. In one study, 42% of participants with low thyroid hormone reported sleeping more than usual, but 50% of those with clinically diagnosed hypothyroidism reported feeling exhausted all the time. If you are feeling more tired than normal and you don't have a clear reason, you may have hypothyroidism. The second, putting on weight. Unexpected weight gain is yet another typical hypothyroidism symptom. The metabolism changes states when the thyroid is underactive. Your basal metabolic rate, or the amount of energy used at rest, lowers as opposed to burning calories for development and activity. Your body consequently has a tendency to accumulate extra calories from the diet as fat. That's why low thyroid hormone levels might result in weight gain even in cases where caloric intake stays the same. According to one study, individuals who were recently diagnosed with hypothyroidism gained, on average, 15 to 30 pounds in the first year following their diagnosis. First, think about whether any changes to your lifestyle could be the cause of any weight increase you may have been experiencing. See your doctor if, despite following a healthy diet and exercise regimen, you appear to be gaining weight. It could be an indication that there's more going on. Third in order, one of the side effects of burning calories is feeling cold heat. You burn some calories even when you are sitting down. On the other hand, your basal metabolic rate drops when you have hypothyroidism, which lowers the quantity of heat you produce. This explains why having low thyroid hormone makes you feel colder than those around you. Approximately 40% of people with low thyroid feel more sensitive to cold than normal. It's possible that your build is what makes you the person you are if you've always desired to be warmer than the folks you live and work with. However, Hypothyroidism may be the cause if you've recently realized that you feel cooler than usual. Fourth in line, muscle and joint weakness and aches. Reduced thyroid hormone causes proteins to undergo catabolism, or the breakdown of bodily structures like muscle to make energy. Muscle strength declines during catabolism, which may cause sensations of weakness. Another cause of pain is the breakdown of muscular tissue. According to a study, 34% of people with low thyroid have muscle cramps when they haven't worked out recently, in comparison to no treatment. Supplementing low thyroid hormone levels with levothyroxine, a synthetic thyroid hormone, enhanced muscle strength and reduced aches and pains in a study, including 35 people with hypothyroidism. It's common to feel weak and achy after intense activity. However, you should schedule a visit with your doctor if you have any new, especially persistent weakness or pain. Number 5. Hair loss. Thyroid hormone controls hair follicles, much like it does most other cells. Hair follicles are more susceptible to low thyroid levels than other tissues because they contain stem cells with a short lifespan and a high turnover rate. Hair follicles stop growing as a result of low thyroid hormone, which leads to hair loss. When the thyroid problem is treated, this usually gets better. In one study, low thyroid hormone was discovered in roughly 25 to 30% of patients who were visiting a specialist for hair loss. If you notice sudden changes in the amount or pattern of your hair loss, especially if it turns coarse or spotty, you may have hypothyroidism. Sixth, dry and itchy skin. Similar to hair follicles, skin cells undergo a rapid turnover process. They are therefore also vulnerable to the thyroid hormone's loss of growth signals. It could take longer for skin to regenerate if the regular cycle of skin regeneration is disrupted. This indicates that the epidermis has sustained damage over a prolonged period of time. It also implies that dry, flaky skin may result from dead skin taking longer to remove. According to one study, 74% of those with low thyroid reported having dry skin. Furthermore, the survey revealed that 50% of hypothyroidism sufferers said that throughout the previous year, their skin had gotten worse. 7. Experiencing melancholy or depression. Depression is associated with hypothyroidism. Although the causes are unknown, this could be a psychological sign of a general decline in vitality and well-being. Depression is reported by 64% of women and 57% of men with hypothyroidism. Seeing a doctor or therapist is a wise decision if you are experiencing depression. Whether your depression is brought on by thyroid issues or something else entirely, they might be able to support you in overcoming it. The 8th number. Problems focusing or recalling. A common complaint among hypothyroidism sufferers is fogginess or difficulty concentrating. Each person experiences mental fogginess differently. In one study, 22% of people with low thyroid syndrome reported finding it harder to solve simple math problems. 36% said they thought slower than usual, and 39% said they had worse memories. Although the exact causes of this are still unknown, treating low thyroid hormone helps with memory problems. Everyone occasionally experiences memory or attention issues, but if they occur suddenly or severely, they may indicate hypothyroidism. 9 is the number. Constipation. Your colon may become comatose due to low thyroid function. One study found that whilst 10% of patients with normal thyroid levels have constipation, 17% of people with low thyroid hormone do. In this study, compared to only 6% of those with normal thyroid function, 20% of those with hypothyroidism said that their constipation was growing worse. Before you worry about your thyroid, consider these natural laxatives if you are constipated but otherwise feel great. Medical attention. If they don't work, your constipation gets worse, you go several days without passing stool, or you start experiencing nausea or stomach pain. 10th position. Excessive or unusual periods. Menstrual bleeding, both excessive and irregular, is associated with hypothyroidism. According to one study, compared to 26% of women with normal thyroid levels, around 40% of women with low thyroid hormone experienced increased irregularities in their menstrual cycles or severe bleeding in the past year. Abnormal amounts of thyroid hormone can interfere with other hormones that regulate the menstrual cycle by interfering with their signals. Thyroid hormone also has a direct impact on the uterus and ovaries. Other than hypothyroidism, a number of issues can result in heavy or irregular menstruation. Before you worry about your thyroid, consider speaking with a gynecologist if your heavy or irregular periods are interfering with your lifestyle. Please see your doctor for a more thorough assessment if you have any of these symptoms. Following diagnosis, levothyroxine tablets are taken daily to treat hypothyroidism. Your doctor will determine the ideal dosage by comparing your blood work and improvement levels. If you recognize these symptoms in yourself or a loved one, it is essential to consult a healthcare provider. Early detection and treatment of hypothyroidism can significantly improve quality of life and prevent complications. Treatments typically involve hormone replacement therapy, which can help restore normal thyroid function and alleviate symptoms. Regular monitoring and adjustments by your healthcare provider are crucial to manage the condition effectively. Understanding the signs and taking proactive steps can lead to better health outcomes and a more energetic, balanced life. Thank you for tuning in to Health Angel Solutions. We hope this video has provided valuable insights into recognizing the signs and symptoms of low thyroid levels or hypothyroidism. At Health Angel Solutions, we are dedicated to bringing you the most accurate and helpful health information, empowering you to take charge of your well-being. Please give this video a thumbs up and tell your friends and family about it if you thought it was informative. Your support helps us reach more people who could benefit from our content. Remember to click the notification bell and subscribe to our channel to ensure that you never miss an update on the newest health advice and treatments. We appreciate your time and commitment to improving your health. Stay tuned for more videos from Health Angel Solutions, where we strive to bring you the best in health and wellness advice. Remember, your health is your wealth, and we're here to help you safeguard it every step of the way. We appreciate your time and we'll see you in the upcoming video.